It's crazy. We've done it to ourselves. We've created perverse incentives in the public policy that discourage people from taking personal responsibility, and in the process, we're bankrupting the social safety net that should be there, needs to be there for the genuinely needy, but is currently carrying too heavy a load of the middle class and affluent as well.
So, I mean, a lot of times, Democrats get wild-eyed when you talk about this, but what you're talking about is that you're not talking about taking stuff away from the poor, the very poor. You're talking about making some changes for people who've got some money.
What I'm all about is preserving a quality safety net, particularly for long-term care for people in genuine need. And the only way to do that is to start 20 years ahead of when they need it and divert the middle class and affluent into methods by which they can pay privately for their long-term care and avoid becoming dependent on Medicaid. And the reason they need to do that is that in the future, looking forward, you're going to see a brick wall of fiscal reality coming. That social safety net that has been there since the 1930s and since 1965 for long-term care through Medicaid can't continue at the current rate. So you may become dependent on a public welfare program that can't afford to support you. If you prepare in advance and you save, invest, or insure, then you're a private payer and you command red carpet access to top quality care. It can help you stay out of a nursing home, which is where you're likely to end up if you go on the public program. If you can pay privately, you can get quality care in the home and in the community. If you need more care, you can afford assisted living, which is 80 to 90% private pay. And if you ever do need it, hopefully we can salvage something of a safety net for you when you become one of the genuinely needy.